Welcome to the Research Works podcast, brought to you in association with Curtin University and the Healthy Strides Foundation. Your hosts are Dr. Dayna and Dr. Ashleigh Thornton, and together we will interview world-leading researchers in the area of child health to support your practice in being more evidence-based.
The team at the Research Works podcast acknowledges the traditional custodians of the land and waters on which we live and work. We pay our respects to all First Nations peoples, elders past and present, and would like to acknowledge the traditional custodians of the land on which we record this podcast each week, the Whadjuk people of the Noongar Nation. We recognise their continued connection to this beautiful budja we call home.
Hello, everyone. Welcome to Research Works. Hello, Ash. How are you?
Hello, Dayna. I'm well. How are you?
I am so good. So very good.
Oh, I'm pleased to hear that. I am pretty excited about today.
Mm-hmm.
And do you know why?
Why?
The last two episodes, as you know and our listeners know, we have been talking about this concept of on-time mobility and this fundamental truth that mobility is a human right, and we've had a number of wonderful guests. We had Andrina Sabay, Heather Feldner, Sam Logan, who all joined us to share their thoughts about it.
Yes.
And given that there's so many conversations around this topic, we thought that a nice round table with some very experienced clinicians who are actively putting this concept into place is very timely.
I think so great. And the fact that we've got a round table is perfect.
We have a round table. We have the clinicians who we're going to introduce to you now. So welcome Marissa Smith, who is a physiotherapist, and Loren West, who's an occupational therapist from Healthy Strides.
Hello.
Hello. Thanks for having us. Yeah, very excited to be here.
Oh, I'm glad.
Yeah, thank you for joining us.
It's so nice to do this. I think the last time we actually had a clinician takeover was in the first season. And, you know, we've had a lot of comments about how useful it can be to explore topics, and sometimes there's a lot of different kinds of conversations. You know, communication's a big part of what we do. And hopefully, you know, us having this conversation about this topic can also be helpful for you to start more conversations with people in your world.
Yeah, I think it's so valuable. We talk a lot about translation of research into practice, and it's one thing to have, you know, researchers come on the podcast and talk to us about their findings, but to talk to the people on the ground about what that means for them and their clinical practice, I think is so incredibly valuable.
Yeah, it's another layer. It's good. I like it.
Yeah. So Loren and Marissa, we normally start with an icebreaker question. We thought we'd mix things up a bit today. We've got our round table. We've got a full table today. So we thought we'd do some flash quiz questions with you, help everyone get to know you a little bit better. Don't worry, they're not too tricky.
They look worried.
They do. We always play nice.
We are very nice. Yeah.
Okay, so our first question, it's not a formal bio, just an informal getting to know you. What do you do as a clinician? I'm going to get Marissa to answer this one first.
Thanks, Ash. So I work as a physiotherapist at Healthy Strides, and I also help coordinate the programs here. But my role as a physio starts off from when clients and families first come to Healthy Strides. So from their initial assessments and their kind of initial inquiries through to them coming for a program, and then moving through some we've been seeing for the last 5.5 years for multiple programs. Yeah, and so as a physio, obviously doing assessments, developing programs, but what I'm most passionate about is educating families so they can make the best possible choices for their kids to have the best impacts on them.
I love that.
It's so great.
Loren, what do you do?
That was very well said, Marissa. So I'm an occupational therapist at Healthy Strides. So I work with kids from a range of ages, from below 2 to young adults. And I work with the team at Healthy Strides across all of their programs to make sure that they're having fun and it's evidence-based, and that we're really working on their individual goals.
Yeah, it's really cool.
Yeah. And in the interest of fairness, Loren, I'll get you to answer this next question first, because we're all about fair here.
Yeah, that's true.
What do you love most about your job?
Oh, there's so many things. It's really hard to pick one. But I love that I'm working in a job that I'm really proud of. I love that I can actually see tangible and meaningful change with the kids that come see us. And I love just meeting families and educating and then just sharing the journey with them.
Yeah, that's so cool.
What about you, Marissa?
Loren's pretty much said it all. I love that as well for exactly the same reason. It doesn't feel like a job. It's a passion put into action as such. And I feel a privilege to do this job. So not only the other clients, their families, and our team is just, Loren and I work a lot together, and I really love it, and I value that because, you can build into each other. Yeah. You shoot ideas off each other. So that team collaboration is really important too. Yeah. I love it.
Cool. What's the most challenging part of your role, do you think?
Can I say I wish there was more hours in a day?
I think we can all say that's pretty cool.
Potentially that, because the actual role itself I love. I think it's just I wish you can do more. There's only so much, but you do the best you can, and opportunities are endless.
Yeah. What about you, Loren?
I would say the most challenging thing would be constantly pushing myself to think out of the box, be creative, and be inspiring.
And just bringing that every day. Yeah.
Great answers.
Yeah.
That's really cool.
I know. Really the roundtable's going well so far.
I'm liking this. Yeah. We might need to do more of these. We'll see how we go. Yeah. Well, let's get into our conversation today. Now that we've got a bit of background about these lovely clinicians, our conversation today is going to be based on, as Ash had said, mobility being this fundamental human right that's supported by the United Nations and the On-Time Mobility Framework. So as we might recall in the last few conversations that we've had from our guests, the On-Time Mobility Framework consists of 5 interconnected principles, which are timing of early intervention, urgency with human rights accountability, multimodal with a variety of methods being used, frequency with a daily dosage to assimilate as much as it can, typical amount, and sociability with the context that matters. So we're going to center our conversation on the application of this and what mobility means from the perspective of human rights. It's actually quite meaty.
It is meaty.
Yeah.
And, human rights is a pretty strong term. That's strong language.
It is, yeah.
As therapists, how does it sit with you, this concept of mobility being a human right?
I think it's really exciting to have it out there for the world to hear it. I think it's something that we've been innately passionate about at Healthy Strides, but just having it out there and spoken and written for the world to see and for us to push forward is really exciting.
Yeah. What about you, Marissa? It's a big one, isn't it?
It is a big one because I think, we all take for granted just the ease of which we can move around and explore and interact and socialise and get, our basic wants and needs that come through mobility.
Yeah.
And I think, like Loren was saying, it's something we're really passionate about here. And, we've seen it in action. Yeah. And that's why we're like, this has to happen more. We want to get this out there. Yeah. This is a fundamental human right.
Yeah. It's so great. And I think, for us, knowing that we want to push mobility, it's a really natural thing for us to think about mobility being so important. It is like, how is this different, I suppose, from your perspective to what's always been done before?
So it's very different from when I first started in paediatrics over 10 years ago. It was very much about milestones. And so we wouldn't look at getting children up into walkers till they were, say, 2 or 3 or till they could stand or stand with support and they could crawl. Because, we know typical development, we have these milestones.
Yeah.
But even typically developing kids sometimes skip a milestone or 2 because there's variation.
Yeah.
So it's very different because it means we don't wait on one thing being achieved before we go to the next. It means we get kids up on their feet at an age when other children are doing that too, because we know what it opens up. It's not about achieving milestones, about the functional implications of being up, of opening up your world, seeing your friends, interacting with your family. So it just means you can go straight to that. You don't need to be waiting on these certain things and waiting years and waiting out this crucial time before getting a child up on their feet.
Yeah. Especially if you're waiting for something that might not necessarily happen naturally, right?
Yeah. Absolutely. That's the thing. For some children, crawling isn't going to be attainable. And if it is, it's not going to be functional because it's going to be so effortful and so taxing and so fatiguing. So, we already want to kind of skip past that and go to getting them up on their feet because walking may be a more functional and achievable way of them getting around.
Yeah.
Yes, so obviously everyone's individualised and every child is different, every diagnosis is different, but it is just a very different way of thinking of it. It's not step by step like the milestones. Yeah. It's getting kids up and moving and giving them that opportunity.
So as therapists, how do you navigate that with the assessments that you're using? Because I know, a lot of assessments will kind of progress through some of these, what we would typically expect to see in terms of milestones. Families probably come with some preconceived ideas about what they think their child should be doing and at what and the timing of that. So how do you frame those conversations with families, or how do you manage those expectations, I guess?
Yeah.
I think that what's really exciting is that these families come in wanting to experience something different, something new. So we'll go through some assessments and things like that. We'll talk with the family about what we want to do. We talk about some goals, and then we'll say, look, we'd love to have the opportunity to get your child in a walker and see what that looks like for them if they haven't experienced before. And numerous times they'll get in their walker, the biggest smiles on their face. They can try and take some steps, and it's just a pure joy that we see about them being upright and trying something new. And families, it's so exciting for them. It opens up their world, I think, both the child and the families. Yeah. So it's really exciting.
I guess it's offering an alternative, because I think, when you think about all the services that you go to, you go see a pediatrician, you'll see a child health nurse, and out comes the sheet where you are ticking through milestones. So that's constantly being reinforced in a lot of our industry. And I know it's important to have these points to be able to say, okay, we're a bit off track now. We need to go get further diagnosis for it.
Yeah.
But I suppose from my perspective, whilst that is used for that assessment to guide for some interventions, when it comes to interventions, it doesn't also have to follow the milestones. I think milestones is part of an assessment, whereas the intervention is about looking at how we can maximize what a child's overall development might look like. Because I think it'd be really easy to think milestones assessment, therefore milestones intervention.
Yeah. That makes sense.
I think they're two different things. Yeah. We put them all together as one.
Yeah.
Which is really natural. I can see how that can happen.
Yeah. And I like how you frame that, because the assessment and the kind of looking at where a child is at in relation to some of those milestones might be the trigger for further investigations or, a referral somewhere to get the support that the family needs. But, it doesn't necessarily have to be the basis for what they do within their time in therapy.
Yeah, that's right. So I think this is where the on-time mobility framework comes in, right? So if they are not meeting a particular, say, milestone, okay, we'll look at where that's at. But if they're already 8, 9, 10 months, well, we know that what typically happens around that time is they're on their feet. So if they can't do it by themselves, let's find a way for them to do it with some assistance.
Yeah.
So you're using it to guide what you do, but you're not using it as a strict protocol of what you might need to use to accomplish. Yeah. And I think this must be something that you guys come up with a lot in your jobs. So when you're having those initial conversations with families, and, they might come with that because that's what they've experienced. That's what they've just come from. They're so early, newly diagnosed. They've just come from that. They've come to see you now. And you guys are sort of saying, all right, well, let's get you up and moving in a walking frame. Like, how does that usually look like?
We always give a lot of education. Yeah. So if it's a new thing to the family, some may have tried walkers before, but often they haven't been upright in supported standing. We always explain that they're going to be well supported, well positioned. There's no risk to getting them up. Yeah. And so it's the education to the family. And obviously we use what motivates the child. We have all that ready and raring, the bubbles and the shakers and a number of things, lots of songs. And then we talk them through that process and we get the child up, and often they're really happy being up. Sometimes it's a new thing, and obviously they might be a bit upset, so we won't push it, but we'll introduce the idea to them. But often we get them up, and so often in assessments, families are just so excited by what they see because all of a sudden, for example, I'm just making, let's say an 18-month-old child who can sit unsupported, is starting to do some commando crawling, and their therapy is predominantly focusing on 4-point crawling. And they've never had the opportunity to be upright before.
Wow.
Yeah.
When they come to an assessment, if we get them up and standing in a walker, they get to be like their peers. Other 18-month-olds who are typically developing are up on their feet and walking.
Yeah.
All of a sudden they can be eye level with them. They can talk, they can play. And so parents come in and I think they see opportunities for their children.
Yeah.
Even when they take them to daycare, they can go in their walkers. And do you know what? They're up off the floor, even if they can't yet walk.
Yeah.
It's just that alternative, getting them up on their feet.
Yeah.
Yeah.
And it's then starting that trajectory and seeing where it's going. So I'm going off here. I get very excited. But it's just about... Anyway, I'm going to stop there.
It's the roundtable effect.
It's good.
Yeah.
It's good.
It's a completely different perspective for that child, isn't it? To, go from floor-based activities to being up and being able to take in the world, on their own terms in a way that's, supported and safe.
Yep.
I can only imagine how that would feel.
Yeah.
It opens up so much more opportunity for them as well in terms of engaging with their environment, and we find that they'll vocalise more, they can use their hands in an upright position. It's not just about walking or mobility, it's about all the other areas as well, just as important. And we see it day in, day out.
Yeah.
That's that lovely term that Heather Feldner used, and it's in their paper, isn't it? We learn to move and we move to learn.
Yes.
It was really cool, isn't it? And it makes total sense.
Yeah.
And that, social, emotional, cognitive development is nestled within mobility. I was like, oh, that's right too.
Yeah.
Once you get moving, it all kind of, I think that's really cool.
Yeah. I suppose, to present a fully rounded conversation about this, there's a lot of differing views out there about how early intervention is provided. There's techniques that rely on a lot of handling, but what we're talking about here is, obviously supported but quite autonomous, independent movement in the context of this framework.
Yeah.
So it's more, I suppose, a focus on quality of movement. And so how do we start talking more about autonomy and exploration for these children? Like, how do you handle those kinds of conversations?
Versus quality of movement.
Sorry. Yeah.
Just kind of bring it back to the evidence. So the research is very, very clear in saying that for kids to learn, they need to be active, and therefore our hands need to be off as much as possible. We're providing the opportunities for them to learn a movement, whether it's stepping or the supported standing. But it's very, very clear, hands off.
Yeah.
The child needs to seek it out. And that's the way they'll ultimately learn.
Yeah. And that's a bit of a reframe, isn't it, from, having to do something right first before you've kind of given permission to take that and use it in the real world. We're not talking about that, are we?
No, because some of these children will have a different way of doing things because of whatever their diagnosis is. They may have spasticity, they may have different, joint ranges and dystonia, things like that. That means, do you know what, if we keep waiting for it to happen normally, it won't. And it may actually be detrimental in impacting what they could achieve functionally if we did just press on.
Yeah.
And, we're always doing this in a safe and supported way. So to me, it's a no-brainer.
I think when it comes down to it, we just want them to be motivated to move and explore in whatever way that looks like for them in any way, shape or form, and just to want to get around and interact with their environment.
Yeah. And I think for me, I come back to what you were just saying about learning to move.
Yeah.
I think people get stuck on the learning to move part of it.
True.
Without thinking about
the next part,
the moving to learn.
Yeah.
And what we're really doing with this framework is providing the opportunity to learn through movement.
That's right. And I think what you said there links really nicely with what Loren said. It's the motivation to move.
Yeah.
Because if you are never truly active in moving or seeing what there possibly is to engage in your world, why would you move?
Yeah.
You've got spasticity and dystonia, all these things that make it so hard for you to have rotational movement, and you can't do it on your own. So why would you do it? So that sort of learned helplessness, if I need to move, well, someone's going to move me. So I don't need to worry.
Yeah.
Someone will move me, and they'll move me around to where I need to go. And I will do whatever they want me to do because they're the ones moving me. But if they can actually experience what that movement is, you guys have all got kids. So the minute they see something shiny on the other side of the room, what are they going to do? they're going to go for it.
Yep.
Yeah.
But that desire to go for it means they've seen something, there's a desire, and they're going to problem solve how they're going to get up. They're going to problem solve how they're going to get there. They're going to handle it and feel it with their hands. They'll describe it. Like there's so much in that, right?
Yeah.
And then suddenly there's that motivation. Loren, just talk to me a bit about that motivation. I mean, as an OT, we always I'll put that always as labels for OT. You guys, the play people. I mean, we play pretty good too. But
I was going to say, giving physios a bad rap.
I know. We play really good. But, OTs always are the ones that come along to, I always remember the OTs, you go to home visits, they're the ones with the big baskets with all the toys.
Oh, yeah, definitely.
Right? They've all got the nice little bits and we bring the balls.
Yeah.
You can hear us coming a mile off or jingling.
Everything's happening. But why do you have such a big bag of toys there? Like, how? Tell us about that.
I think it simply comes down to choice, for the children to have choice in what they want to do and how they want to do it. And that empowers them, and then that in turn motivates them even more. So particularly for children that might have limitations in communication and everything's just frustrating. Movement is frustrating. Communication is frustrating. We just want to give them as many choices that they can actively make their own decisions and then the rest comes with it.
Yeah. Yeah. I think that's such a good point. And I guess that comes down to that motivation, that moving to learn and learning to move, all those things and how they're really connected.
Yeah.
Can I circle back to the question that you had from Marissa, and we talked about the quality versus...
Yes.
Because I think that's such a sticking point, and I think that's a big place of conversation. I don't know how many conversations I've been in now where we're talking about they need to have the right amount of trunk rotation, or
you've got to tick these boxes before you can move to the next
and do it ever
stage.
So perfectly, which is a big ask for a kid that has spasticity and dystonia or hypertonia.
Set up to do it perfectly.
Yeah. So I feel like that already answers the question about quality, but I'm sure that comes up a lot in conversations about quality. We need to do it the right way. Like their trunk needs to be straight. Their head needs to be straight. Like how do you handle those conversations? Because I think this is the doozy, I know. But I think those are the things that come up if we're going to try to implement this as much as we can.
Yep. I think it's about timing, because we know, early intervention and getting kids up on their feet should start at a young age. And if we're to wait for quality, what you is on the flip side of that is what you lose in that time.
Yeah.
And if you're, I'm trying to think the best way to describe this. For some children, like Dayna was saying before, because of dystonia, because of spasticity, sometimes it's because of their visual impairment, they may not be able to transition over into 4-point. And so even if you were working on walking and working on crawling and working on getting the quality for transition, the rotation, and then we're working on the quality of the 4-point crawling, it may not be functional because of their lack of rotation. They might not be a transition in and out of crawling, or it's just basically saying it's not about quality, it's about function. It's about getting kids up, not delaying. I don't know if I've explained that well, Dayna. Sorry, jump in.
You'd rather this child being able to do something than to hold them back until they can do it perfectly.
Yeah.
Like, it's that missed opportunity.
That's what it is. It's because you're holding them back. You don't want to delay things. Say for a year, be not going upright when you could have been, and then you miss out, say, between the ages of 1 and 2, being up on your feet and what that brings.
And I think you can frame it in a way of progression as well. Let's start by just getting them able, for example, in a walker, to be able to take some steps and move forward. They might have to lean forward a little bit so it makes it easier for them to step. They may use 2 legs at the same time to move forward, but that's okay. Let's just get them moving, and then we can work on the other stuff later.
And reap the benefits of the opportunities that being upright and moving affords them.
That's right. I mean, okay, let's just go to the basics. You can work on head control and trunk control by being upright. That makes sense, right? Because they're upright. The ribs have the opportunity to descend because you're up against gravity. Let's just talk about all those things like that good old gas.
Issues.
That's a big one. Parents often say for constipation, like being upright is a huge thing.
Yep. And they are things that we know are important, and therefore they're also important for our young people who have all of these other challenges too.
One thing that I also noticed, in terms of not delaying, instead of not waiting for that quality and kind of just going for it, it kind of it makes these children just become so much more alert, it seems, once they're up on their feet.
Yeah.
And the feedback we so often get from families is all of a sudden the child is more interactive at home, is more engaging, is trying to make more vocalizations and sounds, is gesturing to what they want. So it just seems to open up their world. Obviously, they are getting upright, but it really opens up what they can see, and then, like we were talking before, it has that compounded effect across so many different areas.
Yeah. That's a beautiful segue into what I was going to ask you about next, which is how do we translate this into the home environment? So, you know, I imagine it's relatively straightforward to do in a facility like Healthy Strides, where you've got, you know, all the equipment, all the expertise, everyone here to make sure that that happens in a way that's supported and safe for the child. How do you translate that into the home?
I think we just really try and educate what the latest evidence is about being as hands-off as possible. So if most oftentimes families are working on things at home, they want to work with their children for their goals, but just explaining that the child has to be the active ingredient, the active person in any kind of movement. So giving them opportunity and time and setting up their environment in a way that they could actively initiate movement is key.
And then just the different ways you can look at mobility. You know, it's educating families that it's walkers, it's powered mobility, it's bikes and different supported, you know, it's ways of giving them opportunity to explore. And obviously walkers is something we're passionate about because of the benefits of being up. But there's powered mobility tracks, other options. So from us, in terms of getting that into practice at home, it's often education, like Loren was saying, for the family, and then for them working with their community therapist to start looking at maybe trialling some of this equipment and potentially getting it for themselves.
Yeah. And I imagine part of that as well is conversation about what happens at home, like what does a day look like for your family, and
That's right.
how are you all kind of making your way through the world, and how can we support your child to be part of that?
And that's 101, right? Like knowing what happens, what's the routine. But it's, from what you guys have both described, to summarize, I think we've made it less complicated by saying this is the approach, because it's less about the skills of training a parent to be a therapist. Parents should be parents, and they always feel the burden of having to fulfill both, which is exhausting. So as a parent, you just provide an opportunity for your child to play. Let's help them to see what those opportunities are, and it's about the environment. Like, what can we change in the environment, and what kind of equipment can we use to facilitate all of these opportunities? As often, as frequent as possible. No time. Like, you don't have to spend, we talked about with Sam Logan, wasn't it? There's no point doing 20 minutes just because that's what you have to do. And
there'd be a rule around that.
That's right. More than over your day, like, I don't know, really young children. I imagine, I don't have young children, but I've seen it, and it's not like you can structure it to the T. It's so like play is play. And the walker actually gives you that freedom. So it's environment and things like that, but, you know, knowing what their home environment is like.
And just getting them to include it as part of their routine as well. You know, we know these families are busy with appointments and juggling different therapies, and it's about educating them to, you know, with the right equipment, you can actually take your child down to the park with those nice footpaths and with their older siblings, and they might be able to just play and go for a bit of a walk and be up on their feet, outdoors, exploring, and, you know, all that environmental enrichment that comes from that. So educating families how to make it part of their routine. So it's not feeling like a burden of therapy.
An extra
like you said,
thing
it just
that
comes
they have
naturally.
to do.
I think it's releasing. More and more I think about it, you know, this is something that can be done by anyone, really, with that perspective in mind. It's just being open to it and letting go of that guilt of having to go through those milestones.
And I think the on-time mobility framework means that you can, like, there's a really guided place that you can have those conversations with families. You know, it's right there in front of you. That's
right. Let's look at all those principles. How frequently can we do this? As in, let's look at your day. What opportunities are there? What different ways?
It takes a bit of the pressure off, right? Because it's like it just fits in with you and what you're doing.
Rather than being so prescriptive. I've loved this conversation. I think this is really great. Any final thoughts? Maybe this would be a good opportunity for final thoughts. I feel like it's a round table after all.
Take home message.
Yeah. what would you say would be your take-home message or final thought about what we've spoken about today? We'll start with, there's a lot of eyeing around. Marissa!
I think just celebrating each child as, getting them to really enjoy and embrace childhood, instead of focusing on quality of movement and, working on that quality. It's let's let them be a child, have some fun, be up on their feet with their friends, explore, play with their siblings. What an opportunity. And we're not saying not to work on crawling and, and sitting. All those things are important, but it doesn't mean we don't get them up. Let's get them up and see what happens. And you know what? It's always good.
Yeah, nice. Nice.
Yeah, that's a really hard one to top. Marissa, you kind of covered everything there. It's just everything that we put into practice. Now we just want to get out there so that everyone can do that as well and give these children the best opportunities as early on as we can.
Yeah, that's good.
Yeah.
What about you, Ash?
I've been thinking a little bit for the last half of this episode about, I think it's Maria Montessori's philosophy that play is a child's work. And to me, this framework just helps unlock the opportunities for play and exploration and all the things that kids are meant to be doing.
Yes. Yeah, I like that. That's really cool. And it goes back to what Andrew Whitehouse always said, childhood is sacred. Let's look after that time. It's so precious. It's so beautiful.
Yeah.
I have a lot of final thoughts, as you all know. Usually I'm buzzing by this point, and I'm trying to keep
it very...
like
buzzing?
Yeah. I always feel that way when we're talking about topics like this that are very passionate. I would say just give it a go. There's actually no harm in it. So even if you're sitting on the other side and going, hey, I want to go through the miles. This is what I've always done. They need this rotation. They need all of this. Well, I just say just give this a go. It doesn't have to be mutually exclusive. It doesn't mean you can't do that anymore. But I'm just saying give them an opportunity to be upright. Incorporate that in and see what happens because it's worth it. It's so worth it. And, if we really want to support the fact that mobility is a human right, which is strong terminology, I think we need to change with that. You know, that those calls are put out there so we as a society, as a community, as an industry change with it and just give it a go rather than feel threatened or want to critique it. I think give it a go. It doesn't mean you can't do what you're doing before, but give it a go and see.
It doesn't have to be a choice, does it? Like it doesn't have to be one or the other.
Yeah. Let's give it a go. And when you start to see it, I just guarantee that you'll just be blown away by it. And then you'll realize, quality is a little bit less because they can do it. And they're happy. Just give it a go.
I like that. Thank you for coming to our roundtable, Loren and Marissa.
Thank you for having me. Thanks.
Always a lot of fun.
Yeah.
Ash, always fun doing this with you.
Always a pleasure.
Yeah, so good. And I hope for you guys as listeners, you found this helpful too. I think it's, we talk about research so much and there's so much out there. And we've been talking about, this area that we're so passionate about lately, but putting into practice is the next part of it. And I think hearing people think about how to put it into practice is really wonderful. So, let us know your experiences. Writing, we always love hearing about how these things go.
If you've got questions.
Yeah, definitely. Always.
Reach out.
We love it. We absolutely love talking to you guys because we do see there's a lot of you guys listening. So thank you for listening. So remember all of the links for the papers we've spoken about. Just encourage you to have a look at them. They're on researchworks.net and there's a CPD form there you can fill out as well. We want to keep this as part of a record of your PD requirements.
For now.
We say goodbye.
We do. We'll see you next time.
We'll talk to you again then. Thanks, guys.
Bye.
Bye.